Welcome, one and all. My name is Anna Lompriere, and I am a wayfinder. I work for the Cornwall Memory Cafe Network, supporting carers and people living with dementia to access services, make referrals, and really help them find a way to get more support. This is part of Disability Cornwall, and we've decided to create this podcast interviewing experts and people with lived experience on dementia to be able to share all sorts of interesting and informative and supportive information. So sit back and enjoy, and also share the podcast with your friends. It's relaxed and inclusive and welcoming, and thank you for listening. Welcome, everybody. My name is Anna Lompriere, and I am the Wayfinder, working for the Cornwall Memory Cafe Network and Disability Cornwall. And we've been running this podcast, interviewing all sorts of incredible people, people with lived experience and experts, professionals in their field who are researching and studying and finding ways to support people living with dementia. And I am so honoured and excited and privileged today to have the Professor of Dementia Research for the West of England University, who is based in Bristol, here with us today, Rick Chesterton. And was that hello?
Hello.
And Dr. Emily Dodds, who is a senior research fellow at working in the Centre for Public Health and Wellbeing. So thank you both so much for your time. I'm sure you're both really busy, but yeah, we're going to share your information and learning across Cornwall. So Rick, thank you very much for being here. And can we start by learning a little bit more about you and your story and what has brought you to being the Professor of Dementia Research? What got you there?
Hello, Anna, and thank you very much for asking us to be part of your podcast. Journey's was quite a long one. I became a clinical psychologist in 1990 and started working at that time with people living with dementia. Which is a very different sort of, it would be 35 years ago almost. So, it was a very different time of sort of dementia services. Very hospital based, very little diagnosis, very little research, no medications as such. So I started running groups for people living with dementia. For different reasons, and during that started to get an interest in actually, if we talked about what people's experiences were and how they were living and what the diagnosis was like, that this seemed to be quite a helpful thing. So one way or another, I started doing some research and started talking about this, and then together a few years later with one of the other very few clinical psychologists working with people living with dementia, and Marshall, who was also running groups, we started to try and put our thoughts about groups and how they could help people, and how if you brought people together and spoke to them about what they were going through, then why that might be helpful. At that point, nowadays, we think people's lived experience. It was great to hear on your podcast, you're saying you've had lots of people talking about their experiences, but 30 years ago, that wasn't really done very much. And even 15 years ago, when we started working, Anne and I started working on the Living Well with Dementia therapy or course model, it still wasn't really being done very much at that point. Nowadays, we take it more for granted. So really what we did was try and find some way of training other people working in the NHS, but more recently we've been doing quite a lot of work training people working in the voluntary sector to put together a Living Well with Dementia course. And Anne and I wrote a manual, which was our manual, which is really an instruction booklet on how to do it. And since then, and particularly in the last 3 years or so, since the COVID pandemic, Emily and I have been working together to try and deliver that training course to help people to deliver this course, this 8-week course.
Amazing. And that I've got loads of questions already. I want to learn and much more about your course. We're just going to introduce Emily as well. So Emily, tell us how you have found your way into the career that you're doing.
Well, I had a bit of a sort of a different sort of way of doing it. My first degree was in psychology, and actually I did my dissertation around dementia and Alzheimer's. And then my first job outside of university was a support worker for people living with dementia in the community. So I got into dementia that way. And then I went into mental health, so supporting people with anxiety and depression in primary care, in GP surgeries. And then I got a little bit disillusioned with that, to be honest. And I felt that actually thinking more widely about sort of what causes people to have mental health problems and those wider determinants. So Matt took me on the journey of doing a master's in public health, and that's how I've got into public health and wellbeing. And I applied for a job at UWE with Rick and another professor working on a dementia project, and I've just stayed. Really
amazing.
And also I've got some personal experience. My grandfather and my grandmother my grandmother who lived in Cornwall and was Cornish, lived with dementia as well. So I have an interest in dementia from that angle as well. So, and I love it. I think it's a great career, a great interesting career, research and working sort of alongside Rick and working on LivDem as well as other projects around healthy aging is really fascinating, and it's great to be able to think that we're hopefully making a difference to people's lives.
Absolutely. Thank you. Yeah, and I'm picking up so much from what both of you've said around community. And so what about then talking us through the actual program and how the program has come to be, maybe, and what your hope for it is, or yeah.
Well, the program, the course lasts for 8 weeks, and I think it's based on the principle that it's really hard to talk about dementia. I mean, it really is. It's a very difficult, painful, threatening, frightening thing to talk about. And I think for those reasons, often, certainly when I work with families and with couples and people, although it's there and everybody knows about it, often people find it very difficult to actually start to use the words to talk about it. And you don't like to upset people, so people often don't. It's there, but it's not talked about so much for many people, not for everybody. And what the basis of our work is, first of all, that if you bring people together, all of whom have got the same issues or the same diagnosis, then that makes it slightly easier. It's a universal thing. You know, you find you're not the only one. But the second part would be that the way that we find it helps people if they're reluctant or don't know how to talk about it is to not to dive in and say, well, you know, what's Alzheimer's like, but to talk more about the everyday things, you know, losing your keys, forgetting people's names, forgetting where you put things, all those frustrations. And this is people who may have had a diagnosis within the last months or certainly the last year or two.
Okay, yeah.
So it's talking about those everyday frustrations, and then the thing we do is suggest that people talk about what that feels like. You know, people might be embarrassed, they might feel worried about it, they might feel depressed, they might feel frustrated, they might even sometimes feel rather ashamed. You know, these are things that we've done for 80 years of our lives, and suddenly you can't do it anymore, or you forget, when you forget someone's name, it's who's close to you. That's really goes to the heart bottom of your soul, really. It cuts very deeply. So we talk about what goes wrong, how people think about it, feel about it, and then what they do to cope. And everybody's got the different coping strategies, whether that's, sometimes psychologists like to talk about diaries and calendars, but it's often about things like using, you rather than use somebody's name and risk getting it wrong, you say, oh, dearie, or my love, or something like that. You cover it up. So, and again, just talking about those things helps. And then after that, we start to talk about, get the groups to share their worries. Who have they told? What have they told to their partner, their children, their families, their next door neighbour? Those sorts of things, and that's really important about how you disclose things. And then only really, so in 8 weeks, in week 6, we have a quite often very moving, very powerful session where people will go around. At this point, everybody knows each other, they feel safe with each other, and you can start saying, what about the diagnosis itself, about Alzheimer's disease or vascular dementia? People will often have lots of questions about this, really basic questions they've had at the back of their minds but never really been able to ask. So things like, is it inheritable? Will I pass it on to my children? Is it because I did football, rugby? Is it because I got concussed? Is it from my diet? Basic questions like that will often come through at this point that people can share, and I think that's often a very reassuring process. And then the last 2 weeks are very much about, the name of it is living well with dementia. So it's about what can you do now to take control, whether that's making your will, having a power of advanced directives. We talk about driving, which is a very emotional thing for people. It's very part of core freedom, and whether you're giving up driving or not giving up driving. And then also about things like diet, and there are lots of things people can do that will help and to not to cure the dementia, but to slow the progress down, from being more sociable, your diet, taking exercise, things like that. So those are the things that we come on to in the last week. But it's a gradual process. We're very clear that we don't want to force people to talk about something they don't feel ready to do. And that people talk about it really at their own pace. And what people tell us, and we've had a lot of information now. I mean, we have done research studies, but the most, I think for both Emily and myself, the most powerful things are people's testimonies when they've gone through. And occasionally facilitators and people working in NHS or elsewhere will pass us their evaluations with these really powerful stories about how much people have appreciated it and got out of it, how they feel they've changed, been given more confidence, been more able to talk about it. And because you're more able to talk about it, you're more open about it, then you're more able to do things.
Absolutely.
So it sounds a small thing, this talking, but actually it frees people up to do more things in their life. Now, not everybody, for some people it's not what they want and it's not right, but most people who come through, we have our experiences that most people who come through get something out of it.
Wow.
And something that's actually still, I mean, we're far more open about talking, but actually putting together something to allow people to talk on their own. And the most important thing is, although we really like to work with families and supporters and husbands and wives, the group itself is just for the person with dementia.
That's really interesting.
Keep everyone else out at that point.
Yeah.
We want to talk. We want the facilitators to talk to the person with dementia.
That's incredible. So you know what I'm hearing is that you create this safe community, small community space for people that are living with dementia, and you're holding the perspective that you can live well.
Yeah.
And you're coming from the perspective of being professionals, having a huge wealth of knowledge and research and science-backed information that you can tentatively and gently support these people in receiving and bringing into their lives. It sounds brilliant, absolutely brilliant.
Yeah, I mean that you put your word there about being safe, and that's really important. We can't talk about things if we're worried about what's going to happen. or how people are going to react. So bringing people who've only got dementia means that they can take more of a risk, and there's that sense of, well, you're the same as me and you're doing all right, so I can do all right. And although certainly when we've run groups for their times sometimes, and it can be quite upset, people will say things and realize how life has changed and so forth. But what we often find is there's far more about laughter, people joking together, because often laughing at themselves, which you can do in that sort of environment. So there's far more laughter than there is tears. The laughter tears ratio is clearly positive,
quite high.
Laughter. Yeah. People feel very supported, and I think the evidence of that is when we come to the end, often people want to go on meeting in some ways. Now, NHS, voluntary sector, we all have resources. You can't go on, but sometimes it's possible for people to put things together so people can carry on meeting afterwards. And I think that's just evidence of how much support people, or how much people value this support.
And this recognition, what I'm getting through as well, is that you can live well. I think so much from the people that I meet, and also my own preconceived judgments, the fear in society, and maybe this is why people don't speak about it, is that your life is over, and your life is, it's this death of a life. And it sounds like that's not true at all. What do you think about it, Emily?
I was just thinking when Rick was talking that I did a bit of work with the course facilitators a couple of years ago. So we train people to be able to deliver the course out in the community.
Right.
And we brought together a group of course facilitators, and we explored with them a little bit more about what they thought was going on in the groups. And what might be sort of the main areas that are sort of supporting sort of the change for people. And we came up with this sort of idea that the key component of a LivDem group is around its space, which we were talking about earlier, that sort of providing that safe space, but also this pace, which Rick was talking about, going gently to start with, not going straight in on day one about dementia, but talking about sort of how it's affecting people. So that's what we're looking at, is that LivDem provides that space and pace to help people to talk and to come to terms with, and to start adjusting to their diagnosis of dementia. Because when you first get that diagnosis, it's going to be a blow, isn't it? And you're going to have lots of questions and concerns, and not just the person living with it, but also the person that's supporting that person as well. So that's what we're hoping that people get from a LivDem group, is that space and that pace to support them.
And it sounds like what I'm hearing is that there's not necessarily an agenda, that it's a moving, flowing thing, and it's paced for the people in the group, rather than you're going to get trained and you're going to get, it sounds like it's a lot more gently held.
Yeah. And within the training that we provide course facilitators, we have the manual. The manual gives you suggestions of how to do each week, but we also say, it's flexible. You have to work with the people that you've got in front of you, and that is the important bit, and to make sure. And then there's some people that might want to go faster than other groups, so it's about supporting those facilitators to understand how they can support that group the best they can.
Amazing, because how I came in contact with Living Well with Dementia is I was invited to come and talk about some services and practical support that I might be able to give to carers. And the group that I came to was in Camborne, and you did have a carers side, and then the group going on alongside the Living Well with Dementia group, and then the carers were all next door having tea and biscuits. So I sat with them, and just what an awesome thing to be able to still feel that both the loved ones could be at hand nearby, So what's, well, lots of questions, but another question I would have is then how do people out there in Cornwall, I'm sure there will be lots of people wanting to do your course, wanting to do this course and participate. So how would we find, how could we sign up? How would people be able to sign up? What's your vision for the future? What's unfolding in 24, 25?
Well, obviously both Emily and I work at a university, and we're not delivering the LivDem course ourselves. And we've been very fortunate to work with a number of nurses, psychologists, and others, and people in the voluntary sector in Cornwall. We know there's a lot of interest, and we know that people are running groups, but obviously we can't ourselves be people running the groups. So what we'd be very happy to, if people wanted to get in touch with us, we would pass their names on to people who are working in Cornwall and locally. We know that there are plans. We've had a couple of meetings in the last month with the teams from Cornwall. We know they have very active plans to try and start to run groups, but it's a huge county, and transport is very difficult. So their idea is to sort of move from west and mid and east and rotate around. There's only a small number of them, so it might take a while, but we would be very happy to pass names on, and we hope that people would get in touch with you through that way.
Amazing.
I think that's so. We'd be very happy to do that. We also have, one way, if people want to find out more about LivDem, we have a website.
Great.
Rick, you've gone on mute.
Oh, brilliant.
If anybody wants to find out more about LivDem, and that has our email address there.
Great.
You just Google LivDem, LivDem. That's our abbreviation. We call it LivDem. So www.livdem, and that should get you to our website. If you email us, it's livdem@uwe.ac.uk.
Amazing.
We will pass your details on to our colleagues in Cornwall.
Awesome. And we'll put all those contact details in the show notes and everything, so people can reach out if they're interested in becoming facilitators, or if they're keen to learn, to be, to find out how they can join one of your 8-week courses. That would be brilliant. So Emily, is there anything else? What's been going through your mind as we've been going along? Any other thoughts or anything to share?
Yeah, I suppose that I think for us, we with our training program, so we train people, healthcare professionals or people working in voluntary sector organisations that want to deliver LivDem courses, and we recognise that at the moment it is a bit of a postcode lottery really as to where LivDem is being delivered, and so we want to be able to, that, when you asked about the vision for the future, it would be great if we could say, that every trust or every voluntary organisation in a major area is able to provide a LivDem course for those that want to attend. So that would be what we're quite, that would be our vision, I think, is to be able to support people to access a course.
Wouldn't that be amazing? So I'm going to be very nosy now and talk about money then. So the one that was in Camborne, how would that have been funded?
Camborne, I think, was delivered by the local NHS trust. So it would be people, typically they're working in memory clinics or memory assessment services, who've either got the manual or come on the training or done both. But then, yes, that's one of the major problems that we have. That's then dependent on whoever manages that clinic or commissions it to say this is an important thing. And I'm sure people are aware that there's a big there's been lots of moves towards making the dementia assessment and the achieving a diagnosis much faster and quicker, quite rightly, quite understandably. But obviously there's only so much money, and for some services, that's where they put their money, is on the assessment diagnostic process, and what happens afterward can sometimes be a bit neglected. Sometimes people fall through the gaps in the service. The NHS does the diagnosis, and then sometimes it's left up to voluntary sectors to provide the follow-up. So Emily talked about it being a postcode lottery. It very much is. We know in Bristol there's one service, down the road in Bath there's a very, very different one.
Yeah.
There's no wouldn't it in some sense, but it's just what's evolved.
Yes. Wouldn't it be amazing? I'm saying this to the people out there that hold the purse strings and the power. Wouldn't it be amazing if as a person received a diagnosis, they were placed and directed as the beginning of their pathway to an 8-week course where all the different elements or that they would need to learn about benefits and living well with dementia, all those things that you cover in a safe space. It would be a very soft landing, wouldn't it, for them?
Yeah, and I think that's what we hear a lot from people that we talk to, this issue of, when you first get the diagnosis, a lot of times we talk about it as like this cliff edge. You're kind of left and there's nothing offered. And so, yeah, it would be great. And I think there are services that have been able to make sure that the LivDem group is within their service pathway. And I think that's the challenge for a lot of services, like Rick was saying, where there's this focus on sort of diagnosing and assessing. How do you then make sure that there is interventions post-diagnosis that can support people?
Definitely. And there are like you said, we've got PCDPs, dementia support workers, dementia advisors, lots of support coming in now. And just what an amazing thing it would be to have that consistent 8-week experience where you were learning, and also, like you were sort of saying, the one of the sort of heart of what you're doing, what it sounds like, is the friendships that are made, or that sense of a little bit of a community where you're not alone, meeting other people that are going through the same as you, because it's so isolating, isn't it? Even if you're meeting professionals that will support you.
Yeah, and I know in old services do it differently, but I know there's one service that often will, once they've assessed someone and they're suitable for a LivDem course, they'll go on the LivDem course, and then they might then go into a CST, cognitive stimulation therapy course with the same people. So there is that bit of continuity. So so I know that is a service model that seems to work for one patch. So it's just finding what works for and what workforce you have in place to be able to support that pathway as well.
And the consistency is, once you've got a good roadmap, is then having the investment to keep it consistent and keep it going. Yeah. Thank you. Anything else, Rick, before we say goodbye?
Well, thank you for inviting us on and showing interest. And anybody would like to get in touch, even if you've got a question about LivDem, or then please do. And thanks if you put our email address up there. We try and get back to people as soon as we can.
Absolutely.
And very happy to answer any queries that people might have.
Thank you both so much. It's been really, really enjoyable to get to know you both, and thank you for the great work that you're doing. And I'm really looking forward to hearing the podcast back.
Great, thank you. Thank you very much.
All right, have a lovely rest of your day.
Cheers.
Thank you.
Bye.
This video was produced by Discover Voices, part of Disability Cornwall and Isles of Scilly. To check out all of our content, simply search Discover Voices on YouTube.